In the 1800s, a woman could be committed to an asylum for reading too much, for speaking too confidently, for refusing her husband, for grieving too long. In Victorian society, disobedience was sometimes diagnosed as madness. Behind the high stone walls of psychiatric institutions, thousands of women disappeared. Not because they were violent or dangerous, but because they were inconvenient. This is the story of the women locked away for being difficult. During the 19th century, medicine was evolving, but it was far from humane. One of the most common diagnoses for women was hysteria, a vague condition believed to cause emotional instability, irrationality, or excessive independence. Doctors attributed it to everything from nervous temperament to a wandering womb. Symptoms could include talking too much, defying authority, expressing strong opinions, sexual independence, postpartum depression, or prolonged grief. In many cases, a husband or father only needed to sign a form. Once committed, a woman's freedom could vanish overnight. Victorian asylums were not always built with cruelty in mind. Many were constructed with reform and treatment as their stated purpose. But they were overcrowded, understaffed, institutional. Long corridors lined with iron beds, locked wards, high windows that allowed light in but prevented escape. Women were often separated from their children and families, sometimes with no clear path to release. Once inside, it was extremely difficult to leave. Some were held for months, others for decades. Medical authority was rarely questioned, and a woman's protest could be used as further evidence of her supposed instability. Daily life inside the asylum was repetitive and controlled. Women rose early, worked in laundries or sewing rooms, and spent long hours sitting silently in shared wards. Communication was limited. Autonomy was minimal. Treatments included hydrotherapy, where patients were submerged in baths for extended periods, and the so-called rest cure, which confined women to bed rest and isolation for weeks or months at a time. Stimulation was discouraged. Independence was suppressed. Restraints existed. Sedatives were commonly administered. And for many women, the most painful part was not always the treatment itself, but not being believed. Elizabeth Packard was one of the few whose story survived. She was educated, articulate, and religious, but she held theological views that differed from her husband's. In 1860, after publicly disagreeing with him, he had her committed to an Illinois asylum. Doctors declared her sane. Her husband insisted she was not. She remained confined for 3 years. After her release, Elizabeth fought publicly against wrongful confinement laws. Her case exposed how easily women could be institutionalized and how little legal protection they had. Her advocacy eventually led to changes in the law in several states, requiring jury trials before commitment. But for every Elizabeth Packard, there were countless unnamed women. Admission records from the era list reasons such as domestic trouble, melancholia, stubbornness, and even overeducation. Many died within the institutions. Others were transferred, forgotten, or buried in unmarked graves. Some were simply erased from family records entirely. Behind the stone walls of Victorian asylums, not all madness was medical. Sometimes it was social, sometimes it was cultural, and sometimes it was simply a woman refusing to stay silent. The photographs that remain show rows of iron beds, blank expressions, and long corridors fading into shadow. They do not tell us what these women said when the doors closed behind them. But history does leave us one unsettling truth. Not all of the women who were called insane were mentally ill. Some were merely inconvenient. And once the doors shut, inconvenience could look very much like madness.